Friends, hello everybody. What is today's date? Right, it's the 2nd of April. It is a very special and important day. It is Autism, signed this way or this. Awareness Day. Today, being the 2nd of April 2020-21, marks the 14th annual World Autism Awareness Day. Educating the society about autism, its challenges and strengths is crucial in removing the social stigma associated with autism that directly affects the quality of life of families touched by autism. So our aim is to spread this awareness on this day. In this lesson number 126, we will be learning signs related to autism and also understand a bit more in depth about autism and different things connected with that in a clearer manner. Early intervention. Checking beforehand to identify and provide strategies to fix and resolve. In short, EI. Early intervention. Therapy. An expert visitation to provide consultation, awareness and training. Therapy. Occupational therapy. Attempts to help a person who is sick with training, care and development. Occupational therapy. Attempts to help a person who is sick. Speech therapy. Speech and training. Speech therapy. Behavioral therapy. Therapy which helps in improvement of one's behavior. An expert or professional training and planning strategies to help better one's behavior and support with changes. Behavioral therapy. Special education. Special education. Independent living skills. independent living skills. Assisted living, care for persons with disabilities to help them be independent, which is difficult, so monitoring by medical professionals and care and support given so that people with disabilities can live and manage their work. Assisted living, cognitive development, cognitive development, developmental delay, delay in a child's growth and development. Developmental delay, autism is a lifelong neurodevelopmental disorder characterized by difficulty in social interactions, challenges in typical communications such as lack of eye contact, inclinations to routines, presence of restricted and repetitive patterns of behavior, and particular ways of processing sensory information. There could also be co-occurring conditions such as intellectual disorders, seizures, muscle tones, sleep problems, anxiety and mood disorders. Checking beforehand to resolve and fix the problem is very crucial. Early intervention by an interdisciplinary team of professionals such as speech therapists, occupational therapists, psychologists, and special educators is important for the management of autism to plan strategies for the development of the child. Another important factor is the involvement of the family to support and care in the intervention plan. Education given in a special way is very important for children with autism, as children often experience difficulties in auditory processing following instructions and orders, processing information, imitation, organization, and lack motivation, which can make most traditional teaching strategies ineffective. Structured teaching and activities are more meaningful and fits their individual needs because they give clear guidelines about when, what, and how to do the activities. They are predictable and meaningful routines, and the use of visual structural support helps to reduce stress and anxiety and enables better understanding and clarity. And it also increases their active participation and enthusiasm and facilitates independent learning. We will share some common misconceptions associated with autism. All children with autism have some outstanding savant skills. That's wrong. 3. People with autism do not have associated conditions. They don't have other disorders or disabilities. That's not true. They may have other conditions as well. Number 4. Autism is a childhood condition that can be cured or outgrown. That's not true. Number 5. People with autism are not capable of forming meaningful relationships. That's not true. Children with autism are aggressive. They can get violent, etc. But that's not true with all children. Children with autism do not speak. That's not true. It is possible that some may have speaking difficulties, but not all. A few things to be kept in mind while interacting with individuals with autism. To be careful and mindful that they may not like physical touches or handshakes. So we need to understand and interact with them with care and support. Some may not like loud voices or being talked to in a loud voice. So we need to be mindful and talk to them very clearly and in a soft voice and communicate. Some children may not like bright colors, flashy lights. So better to avoid those loud noises, banging sounds, to take care and support them. What is important to remember is the societal attitude needs to be clearer and more supportive and remove any kind of discrimination and social stigma to understand the differences and be supportive. To be careful as well. We need to show a positive and confident spirit and be encouraging and supportive to the families that have children with autism. Attitude is very important So a supportive and caring attitude is a must. Friends, please check the description box below. One of our previous lessons on disabilities had many very important points which we had shared. So please take time to click on the link and watch that video and understand and gain awareness and spread the awareness too and support us. We'll see you soon when we do our next lesson. Bye bye.